Beverly, you came to see me a few months ago with what symptoms?
Well, I had sinus infection, I had ear infections, I was tired, and I was basically very congested.
I see. And how long had you been that way, or how long have you had this congestion sinus problem?
For a long, long time, years.
Years? And have you tried antibiotics before and other treatments based on visits with other doctors?
Definitely. I've done antibiotics several times, usually once or twice a year, but the symptoms always come back.
Right, then you came to see me, we did some testing, and one of those tests showed that you had some reactions to some food allergies, and then the prescribed recommendation was for you to change your diet, not to prescribe a medication, but instead to change your diet based on your individual test results. And what happened as a consequence?
Well, what I've noticed is the congestion has pretty much gone away.
Your nasal congestion?
My nasal congestion has gone away.
Did that surprise you?
It did. But the other thing that happened is my breathing is better
I see.
because I also have asthma.
Uh-huh.
And I've noticed that since I'm not eating certain foods, my breathing is better. The nasal congestion is virtually non-existent. The mucus that when I blow my nose now is basically clear, and that was not the case in the past.
And did it surprise you that food would relate to the symptoms of your respiratory tract?
Yes. I was actually shocked by it. I think being an asthmatic, I'm very sensitive to my breathing and what impacts it. So I think over time I'd started to notice a correlation, but really just kind of thought it was in my head maybe, not because no doctor before had ever really suggested that my eating habits had an impact on my breathing.
Well, as I've learned more about what's causing these ENT problems, in a patient that has sinus infections or sinus problems, it can be bacterial, it can be viral, it could be fungal, it could be the immune system, but that's not where it stops. It could be a problem with food allergies as well. So it's not that I centered on the food allergies. We did those other tests to conclude for you, the individual patient, this was what was causing your set of problems. Well, thank you very much for speaking with me today.
Thank you.
Certainly.